Thank you for joining us, and welcome to another edition of Youth United Working for a Better Future, where we interview interesting and important people who work with to improve the lives of their youth. Joining us today is John Coppola. He's the Executive Director of the New York State Association of Alcoholism and Substance Abuse Providers. Mr. Coppola has a responsibility for representing the interests of alcoholism and substance abuse treatment, prevention, recovery, research, and training providers throughout the state of New York. Prior to becoming the Executive Director of ASAP, Mr. Coppola worked for the Catholic Charities of Montgomery County. He has served on numerous national, regional, and statewide advisory committees and has served in the advisory role of the Office of National Drug Control Policy. Mr. Coppola received his master's degree in social work from the State University of New York at Albany and his bachelor's of arts from psychology from Dominican College. He is a licensed master social worker. So welcome, Mr. Coppola, and thank you for joining us today.
Happy to be here.
All right, so today's discussion will touch on many aspects of substance abuse, and from alcohol to recreational drugs to prescription drug abuse, and how youth are being impacted by all these. So let's start by telling our audience about your work in fighting substance abuse, and why did you choose this as your career path?
Well, I started working in the field right after I got out of graduate school. During my studies in college, I worked as an intern in Amsterdam, New York, in an outpatient drug program. And I really liked that work, and I decided to make it my career.
That's great, and I have also read that you once considered priesthood. And what led you to make such a consideration, and why did you choose to do God's work outside of the church?
Well, that's a great question. I was, as a young boy, grew up in a household where we went to church every Sunday, and I thought from a very young age that I wanted to be a priest. I studied for a number of years to be a priest, and decided that I really wanted to have a family and wanted to, to pursue another direction with my life. So I was very blessed to be part of that world for a number of years of study, and it really helped to form my background professionally.
I understand. And now bringing this discussion is more of a timely one, I guess. Across New York and the nation, we're seeing this epidemic of substance abuse behavior, and it's capped with growing use of actually heroin by youth. And what is going on outside of our communities that's driving the youth to take such a powerful drug?
Well, I mean, it's kind of a complex problem, but to sort of reduce it to simple terms, we live in a society where over-the-counter medications are just so readily available, and the prescription of medications for a variety of different purposes has really gone through the roof. I mean, there was a day when we didn't see commercials on TV marketing prescription drugs directly to people who could potentially benefit from them. But we do now. There's a lot of marketing of medications that goes on, and so there's a substantial increase in the number of people who are prescribed prescription opiates and medications which could easily be diverted to non-medical use. And so very frequently we find that people who have been prescribed a pain medication after having oral surgery or any other kind of surgery, they might use 1 day's worth of medication, and they were prescribed 30 days or 60 days worth of medication. It stays in the closet, and so a lot of times kids and other people will start using those medications recreationally or otherwise, and not realizing that you can get addicted. And what winds up happening is that because heroin is so inexpensive, you can buy a bag of heroin for less than what it costs for a pack of cigarettes. And so somebody has the option now, they're addicted to prescription opiates, and they're going to pay $50 or $60 versus $5. So a lot of people are making that choice to use heroin as a way to take care of their addiction, and it's really very alarming.
And that's also a terrible thing. And if society has been so ineffective in fighting, alcohol and drug abuse in general, I mean, how can the spread of heroin really be stopped? That's a big question.
Well, it really takes a very comprehensive approach, and it can be stopped, or it can at least be substantially reversed. I mean, it starts with prevention. To do prevention and education with our children, and frankly, not just with children, it's with anybody who has the opportunity to be exposed to drugs that could potentially be addicting. And if you think about it, for a senior citizen, somebody who falls, breaks their hip, breaks their leg, breaks their arm, has some kind of an injury, gets prescribed pain medications that could be potentially addictive, might not be educated about the fact that they could become addicted to it, and sometimes inadvertently become addicted, and next thing you know, they're going to multiple doctors and trying to get access to increased medication. So it's really a prevention at all age groups, and then I think it's really important to make sure that treatment is available. That if somebody has an addiction, that they would be able to get treatment on demand, be able to get help with their addiction, and to start a life of recovery. People who have an addiction very much have the opportunity to reverse that and to get into recovery if they seek help, and help should be readily available. So it's really a combination of prevention, treatment, and then supporting people who are in recovery and helping them to stay solid in their recovery.
Especially the youth, a terrible thing. And so obviously we all know that substance abuse is dangerous behavior for the addict, but it's also dangerous to everyone in the general population when you think about the effects: drunk driving, driving while impaired by drugs. Do you think that we're paying enough attention to this problem as a society?
Well, I think I don't know that I would say we're paying enough attention to it, but I would probably say no, we're not. But I think maybe more important is, when we do pay attention, are we paying attention in a way that's going to be helpful? So, when we think about alcohol, for instance, are we appropriately educating youth and young people about about alcoholism and the potential for alcoholism? If you think about it, we've learned so much about addiction in the last decade. We know that alcoholism and addiction to drugs is a disease that's centered in the brain. We know a lot about neurochemistry. So if somebody is the child of an alcoholic, their likelihood of becoming alcoholic at some point in their life is much, much higher than somebody who's not a child of an alcoholic. And so, and if you're the son of an alcoholic father, that's the highest risk group. So if we have an understanding, if I'm the son of a father who's alcoholic, I would understand that if I drink at all, over the course of my lifetime, it's pretty likely that I will at some point exhibit alcoholic behaviors, and that I might become, addicted to alcohol. That's not to say that everybody does, but it's very, very highly likely. So it's really important, I think, for us to think about how to know as much as we can about alcohol and other drugs, to understand their benefits, because there are benefits, and also their dangers. And if we somehow get caught up in the dangers, how to get help. And so, but it is something that affects the whole family. If somebody in the family is suffering from addiction, everybody suffers. And I think the best thing we can do is to increase our awareness about this. And frankly, the other thing is to not demonize or stigmatize the person who's got the addiction. It's an illness, and treatment is available for it. And so we can help people, young and old, and in between, to get the treatment that they need, and to have a life of recovery. If we see this as an illness, if we see it as something that can be treated, and if we don't stigmatize people who suffer from this illness, I think it really would help us a lot to help more people to access treatment when they need it.
I see. And a recent federal survey found that 30% of teens get their alcohol by purchasing it themselves, which is actually mind-blowing if you think about it. So do you think that, police are enforcing laws to prevent alcohol sales to minors with rigor problems that this demands?
I think the police are doing the best job that they can. I think what you're seeing in a lot of communities is parents and concerned citizens working closely with the police department, trying to make sure that sale of alcohol to underage people doesn't happen. It's probably happened, for as long as underage people have been able to get their hands on a couple of dollars. So I don't think it's a problem that we could ever completely get rid of. But I think we should try, and I think that the solution really is working with law enforcement, parents, teachers, raising awareness as much as we possibly can And you know, one of the things we know that, you know, the younger you are when you start drinking, the greater your risk for problem drinking later on in life. So that one of the key things really for reducing problems with alcohol is making sure that the age of first, when people drink for the first time, the later we can make that, the better, and the more likely somebody is to be healthy and to be able to have a drink, you know, periodically and have it not be a problem.
And now moving away from law enforcement, do you believe that parents are doing enough to keep alcohol and prescription drugs away from their kids? If you find, I mean, these outstanding numbers that kids are getting their hands on it more than we think.
Yeah. So parents are not doing enough to keep alcohol and prescription drugs out of their hands of their children. I don't know that they ever have, and I don't know that they ever will. But the bottom line, I think, as it relates to parents, is you know, to be aware of what you have in the house. So how much alcohol is in the house on Monday, and how much alcohol is in the house on Wednesday, and if you didn't have any of that alcohol consumed by adults in the house, and there's some that's missing, we got a problem. The other thing is to understand what we have in our medicine cabinets. Do we have prescription opiates in the medicine cabinet? Do we have drugs in the medicine cabinet that are potentially addictive? Do we have drugs that are, if they're used by our children, that could lead to addiction? So what we know, most homes, a lot of homes have alcohol in them, and it's appropriately in closets. It's parents are aware of how much is there and are monitoring it. But I think very frequently we have no idea what medications are in our medicine cabinets or in any of our drawers. And that's an extraordinarily challenging issue. It's incredibly important for parents to understand what they have in their house, to make sure that it's not accessible to children, young children who could be harmed by exposure, and also very important to realize that most of the prescription drug dependence that we talked about earlier, which does lead later to heroin addiction. Most of those medications were initially procured from a family member. I forget what the percentage is, but it's, you know, close to 50% that comes from family members. Actually, I think it's more than 50%. And so we really have to be very mindful of what's in our medicine cabinets, what's in our drawers, you know, in the bathrooms or in bedrooms, etc. And then there are programs to properly dispose of prescription medications that are not going to be used.
And, you know, continuing on the issue of prescription drugs, what can you tell us on the data, the trend of abuse just on youth?
Okay, so it's extraordinarily troubling that prescription medications are as available on the street as they are. We're seeing dramatic increases in overdose deaths. We're seeing dramatic increases in addiction to heroin, and both of those are driven largely initially by use of prescription medications. So it's extraordinarily concerning that this trend is occurring, and the response really is for more people to be aware, first of all, for people who are using prescription opiates or for people who are using heroin, for us to understand that there is a remedy available when somebody overdoses. It's called Narcan, and folks can be trained in how to administer this drug. So if there's anybody who's watching this show who's aware of somebody who is an IV heroin abuser or user, somebody who's addicted to heroin, somebody who's addicted to pain medications and opiates, there's a high risk for overdose. And members of the family and close friends should get training and be able to administer naloxone to be able to reverse the symptoms of overdose. But it is a significant problem among young people. It's primarily at this point driven by the availability of prescription opiates in medicine cabinets and in homes across our communities. And it is here in the Capital District.
And now we will take an important break for short messages, and we will be right back.
I already knew that I was going to go to college, you know, from a young age. I definitely want to major in political science. After that, I'm going to get my law degree. Then I'm going to come back to Detroit, boost the economy, become the mayor or something, try to make the situation better for other people. I feel like I owe it to the city. I'm determined. It's gonna happen. My name is Justin, and I am your dividend.
Welcome back. We have been discussing substance abuse epidemic and its impact on youth with John Coppola, the Executive Director of the New York State Association of Alcoholism and Substance Abuse Providers. Mr. Coppola represents the interests of alcoholism and substance abuse treatment, prevention, recovery, research, and training providers throughout New York State. So, Mr. Coppola, what exactly is ASAP and how can interested viewers contact the organization?
The New York Association of Alcoholism and Substance Abuse Providers is an organization that works with treatment prevention and recovery support services organizations across New York State. Our website is www.asapnys.org, and if folks had any interest in contacting us, we can be reached at 518-426-3122. We work with prevention, treatment, and recovery programs from throughout New York State.
That's great. And so, what do you think are the root causes of substance abuse for teens and youth? And based on those, is society to blame for the factors that have created this problem?
So, I really think that it's important for us to understand that alcoholism and substance use disorders are a public health problem. It's fundamentally a physiological health problem. Some people have had the experience of trying a drug and never trying it a second time. Some people try a drug and are almost instantly addicted to it. And that is explainable if we were to understand the biology of and how those two people are different biologically. So I think it's extraordinarily helpful for us, first of all, to think about this as a disease, and as it relates to young people. Probably the one thing I would say is that it's so critically important for us to make choices that are as healthy as possible for as long as possible. When we think about going to college and going out with our friends, very frequently alcohol and other drugs might be involved in the conversation. To the extent that we have the ability to be able to not engage in high-risk behaviors, the better job we do at not engaging in high-risk behaviors, the healthier we're likely to be. So I do think that it's really, I think as it relates to young people, it's just so important for us to just be thinking about the level of risk that we have physiologically to have this disease. So if we have alcoholism in our family, if we've got addiction to other drugs in our family, we know that we're high risk, and to be just really extraordinarily careful about what we put into our bodies.
That is true, and more Americans are identifying themselves as having no religious affiliation. So do you think that absence of religion from the homes of these people is contributing to risky behaviors like substance abuse?
Okay, so first of all, there's this concept of risk and protective factors, and affiliation with some sort of higher power, religious organization, etc., is seen as a protective factor. It's one of a number of different things that could be seen as very positive. It is, however, the case that addiction it really does not discriminate. It doesn't matter if you have a religion or you don't, and it doesn't matter what your religion is. You have a risk of becoming addicted. There's ministers and priests and rabbis. There's all kinds of folks who are in recovery from their addiction. And so I think really when we think about religion or any other sort of affiliation that we might have, to whatever extent it can be a source of healing, and to whatever extent it can be a source of strength for us, it could be helpful in sort of maintaining a healthy lifestyle. But I would say that unfortunately, if I am biologically predisposed to having an addiction, whether I have a religion or I don't have religion is really not going to affect my biology as much, I don't think.
I understand. And in countries like China and Russia, drug dealing is actually punishable by death. So, are the laws we have in place here strong enough to discourage and prevent drug dealing and selling to minors on school grounds?
Great question. Great question. And when we think about this, right? So, is this fundamentally, is this a criminal justice problem, or is it a health problem? And I would make the argument that it's a health problem. There's a lot of laws that are involved. You mentioned earlier underage drinking. It's against the law, right? Possession of heroin, against the law. When somebody has an addiction to oxycodone, legally prescribed to them, right? They didn't break the law when they went to the doctor. The doctor didn't break the law when they prescribed it. The person becomes addicted, and all of a sudden we have somebody who's a good citizen who's now behaving in a way that they ordinarily wouldn't. And that's, the impact of the drug on their system. So I think that very frequently, what we really, it's not so much that our laws aren't strong enough. It's really that it's a public health issue. And again, what I would say is, we had the toughest drug laws in the country for years, and as a result, in treating this public health problem as a criminal justice problem, we were building prisons. We were filling those prisons with people who had addiction disorders. So we decided, bad idea, it wasn't working, right? It wasn't working. People still became addicted. People still broke the law. So the key thing, I think, really is more, let's deal with the addiction. And miraculously, when people move from a life of addiction to a life of recovery, they stop breaking the law. People who are abusing their children, not taking proper care of their children, who have an addiction to alcohol or other drugs, start taking better care of their children when they get into recovery. There's all kinds of benefits of treatment and recovery and good prevention in our communities. And I think, so I do think that it's not so much about if we just punish people, they'll stop doing it. Well, that hasn't worked, and it won't work. What we really need is a comprehensive health approach to this, to reduce the number of people and who are addicted, and also to reduce the risk for addiction.
And should we have, tougher laws, but by tougher meaning perhaps life in prison for drug dealers because of the impact on their activities?
Mm-hmm. So, I think that it's really important that when people break the law, that there's consequences. And what I would say, again, I spent years counseling people in a county jail. I've done work in the prison system, and I've encountered many people who are dealing with the consequences of their behavior, specifically because they broke the law. My observation would be some of these people are fundamentally good human beings who did really stupid things. And they did really stupid things when they were high, or when they were drunk, or when they were in the throes of their addiction. As soon as that addiction goes away, you're now again dealing with somebody who is fundamentally a good, responsible person. Very frequently that's the case. So I think it's really critically important for us to, on the one hand, say, yes, okay, so if somebody's dealing drugs and they're knowingly contributing in some negative way to the safety of the community and the health of the community, there should be consequences. Somebody has an addiction, somebody's possessing an illegal drug because they're addicted to it, it's against the law, yes, but my thought is that we're better served by making sure that person gets treatment for their addiction. And frankly, the results are dramatic when people get treatment for their addiction. The criminality disappears, and a lot of the hurt and pain that you were asking about a little bit earlier disappears as well.
And so you're a trained social worker, and so can you share with us a substance abuse horror story where a parent was abusing alcohol or drugs?
Well, so I guess I wouldn't really describe it as a horror story. It's tragic when a parent is addicted to alcohol or other drugs, and it would be very easy for us to look at that person and say, how could you possibly neglect your children? How could you leave them unattended? How could you do these horrible things? It's very simple and easy to explain. When somebody's in the throes of addiction, they do extraordinarily hurtful things. They do extraordinarily ill-informed things. There's almost no negative thing that couldn't happen when a person's in the throes of their addiction, which again is why it's so important to get people into treatment. So again, I think, for many of the folks that are watching this show, personally, a tragedy, a story, and in our communities right now, there's so many people who are suffering from the loss of a loved one to overdose, which really is kind of tragic. And so I think really, the idea is when we all think about the impact of this disease, all of us know of a tragedy, and I think it's just really important for us to really try to focus as much as we can on preventing those tragedies by making sure that we do prevention in our communities at all age groups and getting people access to treatment that they need for their addiction.
And how much of this youth substance abuse would you say is peer pressure or impulsive, immature behavior?
So peer pressure is extraordinarily difficult for anybody to deal with, young people and old. I think that there's so much advertising that targets young people. If you watch television and you watch advertising for alcohol beverages, very frequently that advertising is targeting young people. And young people consume a decent size percentage of alcohol that's sold, and so I think that it's not just about peer pressure. There's advertising. There's all kinds of pressures that portray drinking and drug use in a way that makes it look desirable. So there's a lot of marketing. There's millions upon millions of dollars that are spent on marketing the use of alcohol, and very little money that's spent on a prevention message or on treatment. So I do think, yes, peer pressure plays a role, but the adults are as much responsible, or even more so, responsible for creating a climate in our communities that really makes underage drinking so easy.
And a study a few years ago actually found out that authoritative, strict parenting led to less substance abuse, or actually no substance abuse at all. And so do you think parents are pulling their weight on this issue?
So, if you're a strict parent, will you be less likely to have a child who winds up having an addiction problem? So I'm not really sure how we would define strict. I think it's important for parents to make sure that their children have boundaries, appropriate limits on their behavior and what's permissible in the house and out of the house. So we have some expectations for ourselves about how we behave. And so we have to first think as parents, what is the example that I'm setting for my children about the responsible use of alcohol, the responsible use of prescription medications, the responsible use of any kind of medication or drug. And then secondarily, what are the expectations I have of my children for how they're going to use it or not use it? And if they violate those expectations, are there consequences, yes or no? And the answer to that has to be yes. There has to be consequences. But at the same time, we want to be promoting good communication at home so that when children are exposed to alcohol or other drugs, they can talk about it and have a healthy conversation about it, because it is something that they're going to be exposed to. It's something they're going to have to negotiate. It's something that they're going to be challenged by. And to the extent that they're able to talk with parents about it and talk to other responsible adults about it, that will really help them, I think, a lot in making sure that they don't succumb to problems related to alcohol and drugs.
All that information is very important, and this has been a very interesting discussion, but that is all the time we have for today. So I would like to thank you for joining us, and thank all our viewers for watching. And please join us for the next edition of Youth United. Why? Because it's about you. See you next time.
It's very enjoyable. Thank you very much.